So, hi, Hannah. How are you doing? I hope everything is okay with you.
Yep, good, thank you.
Thanks for coming and speaking to me today about your wonderful private practice. And obviously, you were a participant on, I think, Practice Accelerator 3.
Yes,
Right?
TPPA
Okay,
3.
so that was about a year ago. I think that you started, was it? When did you
Yeah,
do that?
yes, it was a year ago because I first came across your webinar, which was sometime early May last year, and then I remember our planning session, the afternoon, the whole afternoon that we did, all was about the early July, 4th of July, I seem to have in my head.
Right, yeah. So
Yeah,
it was the
around
one
that
where we
time.
ran across summer as well, and
Yes,
holidays in the middle. Yes.
yes, without the coronavirus going on. Yeah.
Oh my goodness, yeah, exactly. Oh, lovely. So, what I'd love to kind of share with people is a little bit your journey in developing your private practice. And so, obviously, Practice Accelerator is just a part of that journey. But can you explain a little bit about your background and then what you do now? So, what was there before and what are you up to now?
Okay, so my background, so I trained as a clinical psychologist, qualifying initially in 2002, and went into a post in the NHS in adult mental health. Worked full-time for a couple of years. I also did some more training. I did a postgrad diploma in psychodynamic psychotherapy, then started having a family, so I had a bit of time out of work. And I think it was probably when I went back part-time that I started doing a bit of private practice as well as my NHS. I worked part-time NHS and a few cases here and there in private practice, but not a lot. And just the odd case if people would phone me for therapy work, really, and if they would want that. So I stayed in my post in the NHS for many years. The job always changed. I've always worked in secondary care, but the location, the team, and as is the case in NHS, everything constantly changed.
Yes.
Whereas now I left the NHS in November 2019.
Yes, it
Yeah.
was last year. It was while you were in Practice Accelerator, I remember.
Yeah, so when I started Practice Accelerator,
Yeah.
I was at that point of I'd had a lot going on in family life, which I know I talked about. We'd lost my sister. She'd been ill with many years with cancer, and I was really struggling in the NHS. We'd just gone through change after change, and it wasn't feeling like I was able to do the type of treatment work, the type of work with the teams that I wanted to do. So I was finding that there was a massive split, that I would come home from my NHS days exhausted, moaning, not happy, do my private practice days full of energy, loving everything that I did, and it was just not working out for me. So it was I made the decision quite quickly to come onto the TPPA course. It almost felt like it was just meant to be. So I saw your advert for the webinar. I can't remember, the webinar was the bucket. I can't remember what it was.
I think it
Quite a
might
few.
have been Money Mindset, the one that you came on. Yeah.
Yeah, and it was about how we create the bucket, and where we go to get the water to fill the bucket, and it just really connected with me, everything that you said. And I think the first thing that I clocked onto was the house in the south of France and the retreat in the in the middle of the
I'll have some of that.
yeah, that sounded perfect. And I don't know, it just sounded like it came at the right time when I was just searching for something. So we talk about this idea of putting things out to the universe and see what comes back. So that was how it fitted for me. And then I think it opened up my eyes to a lot of ways in which we could work and how things could be different. And although when we started, I'd never necessarily planned to leave the NHS for for many reasons it wasn't working out, and it did end up that I left, which I still got very mixed feelings about, but ended up going full-time into private practice in November.
Yeah, exactly. So so it was really it was kind of a whole life pivot for you. I know a lot of people come into Practice Accelerator and you know, they've perhaps been full-time in private practice for quite a while, and I kind of anticipated at the start when I started running TPPA that that would be the way that it would happen. But actually quite a few people now are at that stage of kind of just deciding to let go of moving out of full-time employment somehow, and moving, and not just clinical psychologists, but others as well, you know, moving into doing their own thing, usually because, and I'm there with you, you know, feeling constrained by what an organization wants you to do. And when you're bursting with your own ideas about this, you know, this could be different and I want to do it differently. And I think there's place for both. So, you know, for me, it's good to have a kind of ecosystem. You know, we've got big organizations that do these big things, and then we do need kind of small practices around where people are in there changing things, innovating, trying, being creative, you know, in a way that isn't constrained like it would be in a big organization.
Yeah.
So let us know what you do now. What is it you got up to?
Okay, so my business now is kind of, there's three main aspects that I have to it. So part of the time I spend in therapy working with clients, my main interest really is working with people that have experienced significant trauma or life events that are impacting on their functioning now. And of course, that's been always what we've done since day dot, really, since we qualified as psychologists, my NHS roles, and carrying on with that. But the other bits is largely around EMDR as a therapy, eye movement desensitization and reprocessing. So I trained in that therapy in 2006 and a consultant and facilitator now in EMDR, so have a lot of experience and expertise, which has led to me then developing supervision groups and different supervision packages around EMDR. And my main kind of role within that, which was developed through the TPPA, has been this niche about helping and supporting therapists that are trained and want to grow and develop and become accredited practitioners in EMDR. And I think one of the very first one-to-one meetings that we had, I seem to remember that I had all these muddled ideas in my head, something about loving the supervision, which I kind of threw out to you. You made sense of it all and gave it back to me in a more structured business, theoretical kind of way of understanding it, which I was just like, oh my God, you know, why did I not see that in my head? But you just had that real clarity. And I think that was where the first seeds of thinking about a vision for supervision and for supporting other therapists to grow and develop in their EMDR. So I spend a lot of time doing that, and I still work on the training courses, which I absolutely love. I really enjoy supporting people as they're training in a new model.
Exactly. And I remember one of the things that, because you and I obviously have had lots of conversations as you've been kind of growing the EMDR supervisor, one of the things that came out of your mouth, which I just thought was so perfect, was around this phrase of bridging the gap between training and accreditation, because and that to me is where you really had identified a key kind of a key need, really, which is that people spend a lot of money on their EMDR training, and then, you know, there is a route to accreditation, but you kind of have to, you know, find your own way through it, and through supervision, or so why not just provide a path? You know, provide that kind of, be a guide, you know, in StoryBrand terms, be a guide, kind of hold hands and lead people through this, so that they can feel confident about, you know, taking those steps to use EMDR, integrate it into their practice, and do that sufficiently so that they're able to become, and in the right way, so that they can become accredited. And that was just like, it was so great to see, because so you had that clarity is what I'm saying, and I was like, oh, picking up on, you know, really, I guess really understanding that is the problem you're solving, with the EMDR supervisor, as it became.
So I think the way I was thinking about it initially as well, which it was another thing which you've really helped me on, was thinking, but I can do one-to-one supervision and not really thinking out of the box and thinking about how you can make that more into a business model. Whereas that's evolved then into technology, which I wasn't really all that confident and familiar with using, like we're doing now. So, you know, we meet on Zoom, and now I have group supervisions, and then we also have like a Facebook group that people get access to webinars and other training that's easy to do, but I just hadn't thought about putting it together in such a clear way, and in such a kind of, you know, package up the bits that everybody needs to get what they want in terms of their accreditation.
And one of the things that I know I've reflected this back to you as well, is you have been such a trooper in terms of embracing the technology. And if I may dare say, I can't speak, if I dare say so, I think it looks from the outside at least that it's been a bit of a saving grace through the pandemic. And obviously no one knew this was coming, so this was just you last year going, I need to embrace the website, I need to embrace the social media, and then figure out, you know, how to get these groups online and sort out the Facebook groups. So, you know, as the pandemic has kind of took hold, how did that, you know, what happened in your practice, and what did you learn through that about your, you know, pivoting your practice or changing it or growing or developing?
So like you say, nobody expected that to happen, and it has changed a lot of what I have done. I think it was almost like overnight when we went into lockdown, everything changed. But most of my supervision has been online, so that still stayed the same, which was great. Initially we couldn't do any of the trainings, and it's still a little bit not sure about how that's what's going to happen with that. So I did kind of lose a bit of work in some ways, and there were some clients who just did not want to go on to working online initially. I think people are at a different part in the curve now, and most people that I speak to are more than happy to jump on a Zoom call for therapy. And what I find is that it works just as well, sometimes actually a little bit better in some ways. But it was kind of thinking about how could you use the time, really. So I think that during the pandemic, for me, I spent a lot of time planning work that I had in my head that I was doing months down the line, which was all about preparing the webinars and doing the research and reading the papers. So I've brought a lot of that work forward and done that in the time while we were waiting for EMDR Europe to make their decisions about the trainings, or whether clients were making their decisions about whether to come back on board. And then I think it's doing all the social media and those kind of things, which is bringing clients and business to you. So it was pivoting in that way as well, and having a bit of a strategy about where I'm going with those kind of posts.
It's brilliant. It's been an enormous learning curve, it looks like, since this time last year. And so if you're going to kind of compare or you know, think about the learning curve that you've been on, what would you say you've learned about yourself?
My goodness, I think it's been a massive learning curve. There's been so much that we don't know, you know, when we trained as psychologists, about business models and about marketing and about I think the key thing for me, really important, is about finding who you are and what you want to do, and somehow working for a big organisation like the NHS. I feel really bad to say it, but it kind of feels that they don't nurture who you are and what you want to do. You've got to fit into a model that they've got to provide. So you end up doing parts of your job that you really dislike. It doesn't spark joy. You've got no passion there, but you have to do it because that's just part of being an employee. And it's took me a while, and I'm still going through that transition, to kind of step back and think I can be as creative as I want to be, and work in whatever way works well, you know, obviously within certain boundaries of how I want things to be. Like, you know, the day after lockdown, my appointments could just be online, whereas with the NHS or with other things, you know, you've got to go through all the hoops and whatnot before you can get there. So I think that learning that I'm still on, and will be on it forever, really, has just been really diving into what makes me most passionate and what I really want to do with my life. Because I think when we go back to one of the main reasons with my sister why we started this is, you know, you've got to be doing, you've got one life, you've got a chance to live it how you want and to do the work that you want. And, you know, why spend time doing stuff that doesn't make your heart sing, that doesn't make you passionate, so you don't enjoy.
It's a really kind of it's just profoundly important, and we bring so much of ourselves to our profession anyway, that, as you said, the more that we can kind of channel that into our practice, just empowers our practice and empowers clients through it. You know, that's what I feel anyway. What would you say is, what has been a real highlight, and what has been perhaps your biggest challenge in Practice Accelerator?
I don't know, there's been too many highlights to think of. France, obviously, going out. There was, well, you know, not just because it was France, in a beautiful house and a beautiful place and nice food and wine and all that, but just something about the depth of 2 days of really focusing in on your business, really visualizing and doing this creative stuff, and really diving deep and recognizing the blocks. And I think, you know, that's been a highlight, to recognize those, the mindset stuff that really holds us back in our business. But I think without having the time to do that in an intense way, you might not have got to those points. So that's definitely been it. The structure's been fantastic with the TPPA, that you've got that accountability, that you know, that you've got your session every 3 weeks where you've worked on a goal, and then you're bringing it back and sharing and talking it through.
Exactly. So there's not really, I think, in a nice way, I mean, nobody ever gets badgered or hectored, but at the same time, there's that kind of that sense that we're on a journey, and we're taking steps. Therefore, you know, and people are going to help you take those steps, but you're taking those steps. Whereas when you're on your own, you can get a little bit kind of sidetracked, or maybe get a little bit like, oh, I don't know if I want to do that, or maybe I'll just avoid that for a little bit, you know.
And it's having that supportive community that is definitely a highlight that's available. And having the again, the Facebook groups support, and having people that have already been through and seeing exactly like what you're saying, some of the amazing stuff that people are doing, and just having that support when you have your wobbles. We try and have them all the time. I'm like, oh my god, I posted this on Instagram, should I have said that? And, you know, just clarity and support, say, you know, you're okay, you're doing a good enough job. So I think those are the big things that have been really critical to me.
So last question would be, what would be one word of advice to fellow psychologists in private practice?
Definitely follow your dreams and have a strategic plan that will get you to that end goal. So I always look for I don't know whether I used to do this or I've learned to do this more, look for what you hope and dream for it to be like, and track back and see what you need to do to get there.
Exactly. I think some of that thing of, setting your dreams, but then let's have a pragmatic plan for making that a reality.
Yeah.
Definitely.
And understanding that, it is possible, really. I feel like too much before we were just kind of treading water and getting by, whereas it feels very different within the business now.
Yeah, perfect. All right. So where can we find you online?
Okay, so confusingly, I have two websites because it's covering the two parts of the work that I do. So it's the EMDRsupervisor.com for anything to do with EMDR supervision from a therapist perspective, and then Dr. Hannah Bryan in terms of the therapy. And I'm also on Instagram as the trauma psychologist, trauma_psychologist, and my Facebook page is the EMDR supervisor.
Perfect. I love it.
Yeah.
I love the EMDR supervisor as a URL. It's just awesome. And
Yes. Well, I remember getting to that point when I would probably upset my husband because he's been really helping me with the IT. And my website was Dr. Hannah Bryan, and I think it was maybe our last meeting, and we were just talking about it, and we Googled how much there were to buy, and I remember coming downstairs and saying to Matt, I think I'm going to have two websites now, and he was like, oh, I've only just got my head around the one. So yeah, but but it's interesting because that seed was planted months and months before, but it was only that moment that everything that I was doing became under this branch of the EMDR supervisor.
And I think that's very normal, because what I remember is that your brand essentially developed. And so, as you got more clarity about those two areas of your business, it just became, first of all, it became really difficult to make them both live together on the same website. Yeah. And secondly, it became really clear how different they were. Like these are two things.
Yeah.
Perfect.
And then you look back and you think, well, I was always heading there anyway. But when we first started, it wasn't as like that. But no, it's wonderful. I love it.
Perfect. Thanks very much, Hannah. It's been wonderful to catch up with you again. And I will see you in the Facebook group, no doubt. See you on Instagram and everything.
Yeah, always on there. Thank you.
No worries. Take care.